And we now know that you are concerned, so many people, about Chris Cuomo, those who do have it. So what does it mean for you and your family? What if you get it? Who's a carrier? Who's at risk? A lot of questions. Dr. Jen Caudle is here to answer some of those pressing questions. Doctor, good to see you. Chris Cuomo saying, look, I wish I had it earlier because it certainly is a different perspective. You can talk about it all you want, but once you feel the effects of this, he said he chipped a tooth at night from shivering so much, sweats, hallucinating even. I mean, he wasn't sugarcoating it.
No, he wasn't at all. And you know, God bless Chris Cuomo and everyone else who's gotten coronavirus. It's certainly a shame and a tragedy. But, you know, we know there are lots of symptoms you can have. He's mentioned many of them, the fevers, the chills, the shakes, myalgias. But I also want to, Susan, draw attention to other symptoms that we're learning about, the loss of smell or taste, diarrhea, vomiting, other symptoms that we're just sort of learning about. But I do appreciate Chris talking to us about what he's going through so we can learn more.
Saying this is no joke, and he even said he would be more concerned if he had shortness of breath, if it went to its lungs, which so far it is not, thank goodness. This question, Dr. Jen, comes from Rodney on Twitter. He says, what if any medicine can be taken beforehand as a precaution for coronavirus? And I'm going to add in there maybe vitamins or supplements to build up your immune system. Does that work?
So right now, there's no FDA-approved medication to cure or prevent coronavirus. We know there are many medications in the pipeline that are currently being studied to see if they're effective against coronavirus, which is a good thing. But we have to remember, the overall thing. The best thing that we need to be doing right now is what Dr. Fauci and so many others are saying. The best prevention is the social distancing, the hand washing, proper hand sanitizing, disinfecting, and things like that. I do want to say, Susan, there are other things that we can do. We need to make sure that we don't smoke. If you smoke, this is a time to quit, and certainly don't start smoking. Also making sure that we have a healthy diet, that we're trying to get some exercise, even though we're social distancing. You can still exercise and social distance. Just making sure that we're getting enough sleep and minimizing stress and things like that. Those are the things that I'm recommending to my patients to make sure that we stay as healthy as possible. But remember, the biggest prevention, not only is those things, but the social distancing.
It is key. We know you're sticking around. We'll see you in a few. Dr. Caudle, thank you.
Thank you.